Good evening. So let's start with the good news about the flu. Today, the CDC said that the flu season in much of the country appears to have peaked, so we've seen the worst of it. But the worst still includes this. The flu is now widespread in all but 6 states, and it's sending Americans 65 and older to the hospital at the highest rate in at least a decade. Here's Dr. Jon LaPook.
At a senior center in New York City, the Friday bingo game is in full swing. But 96-year-old May Robinson is thinking about her friend who recently caught the flu.
My deceased friend had it. They worked very hard to save her, but she passed.
The CDC began tracking flu hospitalization rates 10 years ago. This year, the hospitalization rate for patients over 65 has been more than twice the average rate over the previous 5 seasons. Dr. Susan Ream is an infectious disease specialist at the Cleveland Clinic.
People who are 65 years of age and up tend to have other diseases like heart disease, diabetes, kidney disease, and also the immune system as we age doesn't work quite as well.
Most of this year's flu is from an especially nasty strain called H3N2. In past years, H3N2 has caused a 2 to 3 times higher hospitalization and death rate than normal. In addition, the strain mutated soon after production of this year's flu vaccine began. Too late to change it. 2 weeks ago, the CDC reported the effectiveness of this season's vaccine, only 23%.
H3N2 tends to cause more severe illness, and because the vaccine isn't fully active against the strain of H3N2, we have a double whammy this year.
Flu vaccine takes only about 2 weeks to kick in, so it's not too late to get it, since flu season can last until May. The CDC is urging people with flu-like symptoms to contact their health providers about possible antiviral medications because they can help prevent complications.
Vaccines work. Thank you, John.